Today, I'm joined by Eduardo Ponce, Operations Lead at Provisional Health Services Authority. Welcome, Eduardo, and thank you for joining Caspio's podcast today. Can I please ask you to share with everyone a little bit about your background and introduce yourself?
Thank you. Hi, Paul. Thanks. First of all, thank you for having me in the podcast. It is exciting to join you and to share one more story about how Caspio can be used. So, as you said, my name is Eduardo Ponce. I work with the Provincial Health Services Authority here in British Columbia, Canada. I have been working for since 2016 in a project called the CST project. So it stands for Clinical and Systems Transformation Project, and it's a joint initiative of three of the health organizations in British Columbia that is implementing an Oracle health-based system. We call it CST Cerner. It's a clinical information system that we started implementing in 2018, and it has now been rolled out to 50 different facilities across British Columbia, 550 clinics, and we have implemented the system with now we have over 44,000 users since our first implementation.
Wow.
I'm part of the learning team, so I am the lead for learning operations. So my team has been in charge of the training of all the end users of our system across all our implementations. So yeah, back from 2018, we have been training every single user that gets to touch the system we have been implementing.
That's staggering. So I know you've been a Caspio customer now for just over 2 years. Can you remember what the key challenges were before you looked at Caspio and low code?
Yes. So as part of our training structure, users have to access our trained domains and do some hands-on training. When we started training before COVID, users would come to a classroom session. We had these printouts with all the logins, the passwords, and the mock patient information that they would need for their training. And at the end of the session, they would give us that back, and that would be the same information we would give the users the next day. When COVID hit in 2020, that model had to change. So we had to move to a remote training module. We couldn't have users coming to a classroom session. So one of the big challenges that we had was we needed to distribute this information every single day to the users that needed to do the training. At the beginning, one of the approaches that we did was, okay, we need to have as many user names and logins and mock patient information for every single user in the new site. So my team would be sending individual emails to every single user in the implementation about how to access the train domains and where to retrieve the information. We started with a smaller implementation with that. And then when we tried to scale that up for a larger site, it became really complicated to keep track of everything that we were assigning to the users. And due to the capacity in the train domain, we were not able to give a single account to every single user. Users needed to share, and we needed to find a way for users to share. So we went through different approaches in the more middle-sized hospitals that we were implementing the system. But in 2022, we were approaching one of our largest implementations in the whole roadmap.
Mm-hmm.
And so I started chatting with my team, and it became very clear that whatever other approaches we had been using would not make the cut when we reached this large hospital. So it was clear to us that we needed something that was like a self-checkout tool for the users that worked just in time and on demand without having a middleman that had to distribute the information. I knocked different doors. Our technical teams were interested in developing it, but they were super busy with other things. And as we were approaching the implementation, I said, okay, I have some notions about how databases work. I have some notions about coding. There must be a solution out there that can help me put these two things together and make a solution available for our end users. So I remember it was a Thursday that I started Googling. Like there must be something. So I searched for service providers that offered database functionality and the ability to put web forms out. I saw some some rankings and that's how I got to Caspio. I remember that I started with a trial version. I reached out to the Caspio team and told them like there is these two pieces of functionality that I need from the trial version. And I started building a prototype with exactly what I needed. Thursday, I worked on it throughout the weekend, I remember. And by Monday, I had a working prototype that I could present to my managers. And I told them like, this is exactly what we need. This is exactly what we have been looking for. And yeah, the rest is history. Like we implemented it for that big hospital. It was a success. There was a lot of time saving in and labor saving too for what we were doing. And my team was able to focus on other more important activities. And yeah, after that implementation, there were two other teams that we worked very closely with, and they had a similar need. So I offered like, you know what, like now we have this tool, I can build something very similar to you for you if you need it. So we started scaling it up and bringing it to other teams, and yeah, now we have a few different applications for different audiences. And ever since our use of Caspio has extended to other areas of our work.
Great to hear this, Eduardo. It's interesting how you found Caspio. Can you remember if there's any kind of standout feature, or was there something you thought Caspio is the right fit for me, and we'll take that a little bit further forward?
Uh, Given my limited notions about coding,
Yeah,
of course, having something that didn't require a hard code, like the drag and drop features of,
yeah,
like I knew the basic, but my main concern was that I would not, or I would get stuck more frequently with syntax and missing a command, all those issues that come with coding.
yeah.
So I was very clear in my mind about the logic that I needed. And one thing that stood out from about Caspio is that I had that chance of just dragging and dropping the components of the code without worrying too much about whether I included that comma or that space that was needed at the end of the statement.
Yeah. Eduardo, what was your first kind of impressions of Caspio when you started to go into a little bit deeper after the trial? And how does it fit into your workflow today?
Uh, it, it was really good for me. Like at the beginning, when I started prototyping, it was like, okay, I have the hunch that this will actually work. And it was an issue that I had been trying to solve for a couple of years, like for a
Uh-huh.
year and a half at least. And as I started exploring the features and what else I could automate, and the ability to refresh the database with an automated task at night, and how I started extending into, well, now that I had the app, I could build dashboards about usage and check every day, even from my phone, check how many users we had, and start gauging if I needed to add more logins or patients for some workbooks, etc. So the ability to start with something simple and then quite easily keep growing the use. And for me, something that I've always liked to do is, through the use of technology, enable other colleagues and enable other teams to have their job, to make their job easier. And Caspio has allowed me to do that. I have been able to build quite easily tools that have been like, and I have been told this has been a game changer for our daily workflow. So that has been a real blessing from the tool.
That's amazing to hear. And you mentioned it at the very beginning about that you've got limited kind of coding or technical background. How did you find the learning curve when you first started with the trial and you kind of got into a paid account?
Uh, I don't think that there was a very steep learning curve, even with my very basic notions about SQL
Yeah.
and about coding. Uh, I found it very intuitive from the very beginning. Of course, there were some cases in which I needed to go to the forums to see, like, okay, in Casp in particular, this statement, how do I make it work? Just because the logic was not very clear in my mind. Uh, but there are plenty of support resources around, and I think I can say that very easily. Whatever I stumbled upon, or that became like a roadblock, I was able to sort it out.
Yeah.
And myself and my team also reached out to the support team from Caspio a few times, and they have always been able to provide like if there's not an exact solution to what we need, they have always been able to provide a workaround that fits the end goal or that meets the end goal.
Yeah, it's interesting, Eduardo. What you're saying is that a lot of customers that I talk to have got very little technical background, and they become self-taught by watching the tutorials, the videos, and obviously there's our 24/7 support that can help them as well if they get stuck. And I think it's just seeing people go from having zero experience to building really exciting and powerful applications using the Caspio service. So I think that's kind of where you are in terms of where you are after 2 years of being a Caspio customer, which is great to hear. I was going to ask you about, can you describe your application? What does it do and who are the end users?
Okay, so what we have in our main application, we have a database that has logins
Mhm.
and mock patient information for our training domains. So, for example, if we're gonna train one acute care nurse for the use of our system, she needs a login to get into our train domain that is specific to the position that she will be holding in the system. And then we have fake patients or mock patients in the system that has the different characteristics that that specific user would need for her training. So, for example, if we have an acute care nurse that is in the cardiac area, well, we have a patient that came 50 something old year old male patient that came in with chest pain and whose vitals were this and this.
Yeah.
So they need like this very specific set of information to complete their training. We have thousands of patients in our train domain. We have thousands of logins. So we needed to find a way to have the exact information that they needed for the training for the specific user. So we have this database with all this information, and through the data pages, we created a web form that we distribute to the users. And the user goes into our web form. They select the workbook that they need to complete. They give other specifics around the category of user that they are. They provide their name, their email address, and when they click, they receive an email in their inbox that has the login and the mock patient information that they need for their training.
Yeah.
So that is the basic of what our main application does. We have two other applications that does pretty much the same, but for other audiences that we have grown that into. And also we have a very big catalog of workbooks, e-learning modules, and other learning materials, including help topics.
Right.
All that used to be organized in Excel files, which brought its complications of accessibility and how easy it was to share the updated information with other users. And ever since we have moved all that information to a database in Caspio, and now we have different tools that we can provide our partners about how to access the information. And the good thing is that they are always looking at the most up-to-date information because the web form and the reports that they are pulling is connected directly to our source of truth.
Yeah. It sounds like you've got a lot of end users, and I always like to ask customers that I'm talking to about how do you obtain the feedback and how do you bring that back into kind of the development of your application? Because the customers I talk to, we send surveys out. I obviously have conversations. So do the CSMs when they're talking to customers. And it's really important that we obtain customer feedback to go back to our product team, for example, to help look at the roadmap. Is the features that a lot of customers are looking for? Is it something that we can put onto the roadmap? So I'm just curious, how do you obtain the feedback and how does that kind of impact the development of your application?
I think in terms of feedback, I can divide it into two different levels.
Yeah.
The feedback that I have received that my team has received from the end users that are the nurses, the doctors, the
Yeah.
technicians, and clerics that do the training and that they need access to the system. So at the end of the training, in general, we have a survey that we distribute to the users, and they give like the feedback about the quality of the training, how that helped them for the adoption of the system, and also like any hiccups that they experience while doing the actual training. On that front, I'm like happy to report that ever since we implemented this, it was Caspio along with other changes we made to our communications.
Yeah.
Like the number of comments that we have received about the complexities of accessing the training that has decreased. And I think another level of feedback that I would add is like the conversations that we have had with managers from all the facilities where we have implemented the system. Some of them have been our partners throughout different implementations, like even if through different facilities we have been working with the same people from one facility to another,
Mhm.
and they have expressed that like the difference between when we gave the information to each individual user or when we were doing it through the managers to how we do it now, that they have access to just-in-time information directly to the user, that it has been, again, as I said, it has been a game changer in our implementations.
Eduardo, has the application changed from kind of like 2 years ago to where it is now? Has it enhanced? Has it been developed different? Is it just is the kind of the application just very different to what you envisaged at the beginning?
Yes, through the years, I think I have been introducing more small changes to the back end of the code of how the application works. To give you an example, at the beginning, like when a user selected the workbook, then we had a drop down of all the different logins that were available, and the user had to choose a login randomly, and that didn't make a lot of sense, for example. And doing a bit more study about how I could code that, now the system does an automatic selection of the login, and so the user doesn't have to worry about those things. We have different domains, so with the initial design that I had, the system could be biased to sending logins from just one domain. So now I introduced some changes that alternate. It gives the logins for one domain, then for another one, and the other, which has made our like the number of concurrent users that we have in each domain. It has brought it to a more even level. So yeah, in the last couple of years, uh, partially because I want to introduce changes to my application, and part because we have received requests to build applications to other teams. So the requirements that other teams have brought up for their apps sometimes have been challenging to me and had made me explore new things.
Yeah.
And after I do what they ask, I'm like, hey, actually, I could introduce a new change to the original one that can make some improvements there.
It sounds like there's lots of things in the pipeline, which is really exciting. So what's the impact, the positive impact you've seen with using Caspio on the application for the company? If you had to look at it overall, what would you say the benefits that you're finding?
I think it definitely has provided us the ability to provide a much better service to our end users
Yeah.
in a way that has, as I said, it has distributing logins and patients for some time was an activity that took a lot of time of my team.
Yeah.
Like we had to invest a great deal of time of making sure that every user got the information that they needed for their training. And since we started using this application, uh, all that has been automated. It has been crazy for me. Like I pull my dashboard and my usage report every day, and I
Yeah.
see that I don't know 140 users in a given day or 120 users in another day checked out the login and they worked on their training with my team not having to do anything for that end, when that before used to mean 120 emails that someone in my team had to send every day. That has been a massive change that, as I said, has allowed my team to focus on other more important things and providing a better service to our end users in the end.
No, thank you for sharing that. And if anybody's listening to the podcast or watching the video and they're thinking about low code or Caspio, what advice would you give them?
I would say try it out. If you think, or if you're feeling there are some things that you automate, if you are done with doing things in Excel and Excel has become very cumbersome or not scalable for what you are trying to do, give it a try with a trial version. Start working on it, and you will see that very easily you can come up with a prototype that is tailor made to what you need, and that it's really scalable for pretty much any level.
Eduardo, thank you for sharing your advice. Thank you for joining today's podcast. I really enjoyed the conversation. And thank you for being a Caspio customer for 2 years. And it sounds like you've got a lot of things in the pipeline So we're looking forward to many more years of success.
Thank you, Paul, and thank you to all the Caspio team for your support since 2022.
Thanks so much, and we'll talk to you soon.
Thank you.